This is Trevor Birch, a pharmacist I work with, and based on his expertise, I asked him if he would help me out with my project on endorphins. So, Trevor, what are endorphins?
Endorphins are a hormone that your body makes. They are sort of your body's own pain reliever. The word endorphin is actually two words smashed together: endogenous, which means in the body, and morphine, which is a pain reliever. So you can think of it as morphine in the body. Endorphins are often released as a result of traumatic event. You hear of people being attacked by a lion or a tiger, or being in a car accident and having a limb severed off, and they state that they feel no pain. That is a result of your body releasing endorphins. Endorphins are also released in some cases during extended periods of aerobic exercise. You hear people having runner's high, a feeling of euphoria and well-being, which is as a result of the release of endorphins.
How long do the effects last?
It depends on the person, but typically they last 24 to 48 hours, and it depends on the type of trauma as well. People who exercise and have that runner's high, the effects tend to last a little bit longer, and you feel those effects for several days.
Is there a drug that is similar to endorphins?
Yes, there are drugs that are similar to endorphins. Anything that's related to morphine or codeine, you may hear about those in the news, that people use those drugs for the feelings to get high and also to have pain relief. It's important to note that endorphins are not addictive like morphine or codeine are.
Do they help with depression?
Yes, endorphins do help with depression because they do promote feelings of well-being, and endorphins are usually released as a result of exercise. So exercise overall is just an effective part of a treatment for depression because of the release of endorphins causing that feeling of well-being, and also usually it's a social event and people have more feelings of togetherness with others, which helps with depression.
Is there such thing as having too many endorphins?
Yes, there actually is. It's called depersonalization disorder. What that is people experience a too high concentration of endorphins over an extended period of time, which causes an out-of-body feeling. People will say that they can look down upon themselves or they dissociate themselves from reality. So that is usually caused by a traumatic event in their life, such as a history of child abuse, war, natural disasters, things of that nature. Some people are more susceptible than others to depersonalization disorder because of genetics or because of their level of development, whether they're a child, an adolescent, or an adult. There is actually medications out there that are used to reverse the effects of too many endorphins. These drugs were actually developed as a way to reverse morphine overdose, codeine overdose, heroin overdose. Those are all related, so there are drugs out there that they use to reverse that effect, and they can give those drugs to reverse the effect of too many endorphins in the body.
All right, cool. Thank you for your time, Trevor.
You're welcome.